Hello everyone and welcome back to our YouTube channel. Today's video is going to be very short and simple, and we are going to talk about phenylketonuria, also known as PKU. So it is an autosomal recessive disorder in which there is increased amount of phenylalanine and decreased tyrosine. Now, how did we end up having increased phenylalanine and decreased tyrosine? So to understand it, we have to first check out the metabolism of phenylalanine. Phenylalanine is an essential amino acid. So what is an essential amino acid? Your body cannot synthesize it, so you need to obtain it from your diet. So phenylalanine is converted into tyrosine with the help of enzyme phenylalanine hydroxylase. This enzyme requires tetrahydrobiopterin, also known as BH4, as a cofactor. So when phenylalanine is getting converted into tyrosine, BH4 acts as a cofactor and it itself gets converted into BH2. Now you need to replenish your BH4 for this metabolism to occur. So how will you replenish it? So there is this enzyme known as dihydrobiopterin reductase, which uses NADH2. NADH2 gets converted into NAD plus, and BH2 will get converted into BH4 again, and BH4 can act as a cofactor for phenylalanine hydroxylase. So it's like a cycle: BH4 getting converted into BH2, BH2 getting converted into BH4, and phenylalanine getting converted into tyrosine. I hope that makes sense. Now, if there is deficiency of enzyme phenylalanine hydroxylase, what will happen? There will be increase in phenylalanine and we won't have any tyrosine because we don't have this enzyme. There is deficiency of this enzyme. So that's what happens in phenylketonuria. There is deficiency of this enzyme, which is phenylalanine hydroxylase. That is why phenylalanine builds up in our body and it gets metabolized into phenylketones, which are toxic. So what are phenylketones? Phenylacetate, phenylactate, phenylpyruvate. These are phenylketones which are toxic to our body, and when there is increased amount of phenylalanine, it will get converted into phenylketones. Okay, now as I told you, BH4 is a cofactor. So if we have deficiency of BH4, or even if we have a deficiency of dihydrobiopterin reductase, we are going to have the same result, which is increase in phenylalanine and decrease in tyrosine. So that is what is happening in phenylketonuria. And what will be the findings? So the patient will have intellectual disability. There will be microcephaly, seizures, hypopigmented skin. Hypopigmented skin because tyrosine is important for synthesis of melanin. So since you have less amount of tyrosine, you won't be synthesizing melanin, and that is why you will be having hypopigmented skin. Eczema, and this is the classic finding, which is musty body odor. Now we will also talk about phenylalanine embryopathy. So imagine a pregnant female who is not treated for phenylketonuria. Who is suffering from phenylketonuria and not treated. So what is going to happen? So this buildup of phenylalanine is going to be toxic for her fetus. And what will happen? Restricted fetal growth, microcephaly, intellectual disability, congenital heart defects. And how will you manage this? Restricting phenylalanine containing food from your diet. And it is important for PKU patients to avoid aspartame. Aspartame is present in artificial sweeteners, and they must avoid it because it contains phenylalanine. So I hope this small video helped you, and that's all from this video. Thank you so much.